This podcast is for entertainment purposes only and does not substitute for professional medical advice. Please seek a medical professional or healthcare provider if you're seeking any medical advice, diagnosis, or treatment. Thanks, everyone. Hello, everyone.
Hello. I have like dog hair on my microphone.
Yes, I see it here.
It's great. That's what happens when you live with 3 dogs, and none of them are doodles of any type. So they all shed like crazy.
Yes.
I live in hair.
It's like Victor and Carmen when they first got a Roomba and they like just left it going on the entire day. When they came back home, they're like, we had no idea the degree of filth we were living in.
When you empty it out, you're like,
oh my God.
Yeah. It's intense.
Anyways, hi, welcome. This is Funny Medicine.
I'm Evie. You're
Evie?
No, you typically go first. I was waiting for the I'm Evie, and then I'm like, I'm Julie.
I'm Evie.
And I'm Julie.
Not Evie.
No.
It's like that thing. It's like, I am you and you are I, me and you.
Something, yeah.
Yeah, something.
Yeah.
All right, anyways, today's episode is something super trendy. We're literally seeing it everywhere, literally. During Miami of May, literally. And we are talking about the flesh-eating bacteria, Vibrio Vulnificus. What?
I don't know. It just sounded so intense, but it is intense.
It is actually really intense.
It's really intense, especially if you live like in the,
First of all,
if it's
this has
summer.
existed everywhere, right? This exists.
I know,
it's just it's seen an uptake in cases, so that's why everyone is going crazy. It's the same thing all the time with trending things on social media.
And it happens every summer, to a certain degree. But for some reason this summer it's really taken off in the news.
Yeah.
So we're gonna talk about it and tell you guys what the heck is it.
Yes. So Vibrio vulnificus, okay, it's a tiny little marine bacterium with a fearsome reputation. If you've seen headlines about a flesh-eating bacteria attacking beachgoers or raw oyster lovers, chances are that Vibrio, I'm just going to say Vibrio, was the culprit. Okay, so infections are rare but extremely severe. Only about 150 to 200 cases are reported in the US each year, yet roughly 1 in 5 patients can die, sometimes within a day or two of falling ill. This microbe lurks naturally in warm, salty, coastal waters like that brackish water and can turn a really fun day at the beach or a seafood fest or seafood feast into a life-threatening medical emergency. Have you ever been to a seafood festival?
No, I haven't.
Me neither.
I want to.
Yeah, me
and
too.
they have one.
Yeah, in South Beach. They always have it every year.
Cue my dog.
Yes. So let's dive a little bit into what makes Vibrio so notorious. It's also, I feel it's like it's lurking in there. There's bacteria everywhere, guys. But yes, this one is actually a really serious one. So what is Vibrio? So Vibrio vulnificus is a bacterium, specifically a curved, rod-shaped gram-negative bacterium. Thank you, microbiology.
Yep.
Okay, that lives in really warm, brackish seawater. It's philic, meaning it loves salt. In fact, it's right at home in coastal estuaries and saltwater bays. This germ is a natural part of marine ecosystems, so it's not due to pollution or filth or anything like that. It's just part of the ocean's microbial menagerie. Vibrio often takes up a residence in shellfish, okay, so especially oysters, clams, and the guts of fish. So why do we care about this little microbe, right? Because on occasion it jumps from the ocean environment into a human host with nasty results. These infections are pretty severe. So there are 2 main ways that people can get infected. One way is eating raw or undercooked seafood, particularly oysters.
Do you like oysters?
I do not. I've tried them. I've tried them with the hot sauce and everything, but I feel like I'm just dressing it up in so much.
Yeah.
And I'm not into the texture. I've eaten it before, but I'm not into the texture. And also I feel that people really enjoy like the salty water and they can tell where an oyster is from depending on the saltiness or something.
Yeah.
I'm just not into it, to be honest. I don't think it's delicious. And also people just say it's just swallow it. And I'm just, okay, but you're not tasting
That's not the point.
anything.
No. I don't like the big, I don't know where they're from or the whatever. I just know like the sizes, like
Yeah.
the big gooey ones, negative. Absolutely will not even touch it.
Yeah.
Now, if they're like those
The
tiny
tiny
little
ones,
ones,
yeah.
delicious.
Yeah.
For me, at least, delicious.
I've
Like
eaten
I
them.
just put like the mignonette sauce on them.
Yeah.
That's all I put, mignonette and
Lemon.
lemon all throughout the whole thing. Damn, my mouth is watering now. That I really like because they're not slimy because they're tiny, and then they're like salty on their own. That's just how they
Yeah.
taste, and you could actually taste something.
Yeah.
You know, you don't have to just like
I think I've had like the bigger ones. Maybe I haven't tried the smaller ones.
the small ones. Are
And I've
really-
tried it. If someone orders oysters, I'll eat it, to be honest. It's not,
Yeah,
I don't like the texture. I would never order it.
that's the thing. Like I really feel like if you get the smaller ones, you'd probably actually like it.
Like order it.
Yeah.
Yeah. So again, the ways that you can get it is eating raw or undercooked seafood, particularly oysters, so the bacteria can concentrate and in the filter feeding shellfish. A perfectly fine looking raw oyster can actually harbor Vibrio, and if you swallow it alive, the bacteria may multiply in your gut and invade your bloodstream. By the way, you cannot tell if an oyster has Vibrio by taste or smell. It's not like one of those things that's like contaminated or like it's gone bad. The second part, okay, is exposing you with Vibrio like to an open wound. Vibrio can enter through cuts, scrapes, and other breaks in the skin if they contact the infected water or juices from raw seafood. Even the tiniest scratch while handling raw shellfish or a new tattoo in contact with the ocean can be enough for bacteria to invade the tissue. This is why it is so common for providers to say if someone has a cut or an abrasion or a laceration or a dog bite or something like that and they're gonna go to the beach or anything, you should not go into that water because you can get infections like Vibrio.
Yeah.
So the bad part is that once Vibrio gets into a human through either you ingested it or you contaminated a wound with it, it can cause a disease called vibriosis, which in cases can be dangerously aggressive. So we'll explain a little bit about the symptoms and, the horrors of it. But spoiler, this bug didn't earn the nickname flesh-eating bacteria for nothing. It's actually pretty bad. First, a little bit of background on where the Vibrio kind of came from and why it has such a scary sounding name.
Yeah. So, Vibrio. It may be infamous now, but it wasn't identified as a unique species until the 1970s.
So not too terribly long ago.
Yeah, exactly. I mean, yeah. Anyway, so it was first isolated in 1976 by scientists at the U.S. in the CDC from a series, yeah, it is serious, but from a series of blood samples of very sick patients. Early on, researchers noticed this Vibrio bacterium had an odd trait. It could ferment lactose, usually for Vibrios. It was initially dubbed the lactose positive Vibrio. It even had a different name at first, B. vulnifica, until 1979 when it was officially reclassified as Vibrio vulnificus by microbiologist J.J. Farmer. The species name Vulnificus is Latin and literally means to wound or wound maker. Yes, its name practically translates to wound causer, which turned out to be on point given its want for causing horrific wound infections. The genus name Vibrio comes from the Latin vibrare, I guess, meaning to wiggle. A nod to the bacteria's motility under the microscope. They swim with a tiny whip-like tail. I'll put it here. So in a sense, Vibrio vulnificus is the wiggling wound maker, which pretty much sums up its behavior. Historically, Vibrio infections were recognized in retrospect even before the bacterium had a name. Medical literature suggests that ancient physicians may have encountered it. There's speculation that, here we go, Hippocrates, but another one that makes a
Quite the
frequent...
What am I? Cameo.
Frequent cameo from Hippocrates and ancient Egypt. Described a fatal seaside wound infection in the 4th century BC, Greece, that fits Vibrio's profile. In modern times, one of the first big scares came in 1979. Newspapers in South Korea reported an unknown malignant skin disease, causing rapidly spreading flesh-eating wounds in coastal villages. Panic ensued until it was eventually understood to be Vibrio from seafood and seawater exposure. Since being recognized, this bacterium has made occasional news when clusters of infections occur, just like right now, unfortunately. For example, Hurricane Katrina in 2005 caused flooding in New Orleans that led to several Vibrio wound infections among evacuees. The fact that a storm surge could literally wash this marine microbe into city environments hinted at a larger trend we're now seeing with climate change. But more of that later in the news section. So, it's all you, Doc.
All right, so we're going to talk a little bit now and jump into how it makes you sick. Okay, so symptoms and diseases. Once Vibrio manages to infect a person, it can manifest in three main ways. Obviously, if you're ingesting it, you can have one gastroenteritis. That's the fancy medical term for food poisoning. If you eat Vibrio contaminated food, you might get a bad case of watery diarrhea, vomiting, abdominal cramps, and fever. And these abdominal cramps are like pretty severe cramps. Okay?
Horrible. Have you ever had really bad food poisoning?
Yeah.
Oh my God, me too.
Yeah,
that was.
you want to die.
Oh, I couldn't move. Like there was a moment there that I'm in bed. And I'm like, just don't move. And
Yep.
maybe you don't feel pain.
Yep.
Like horrible.
Yeah, and then for healthy people, it might just be an unpleasant bout of like food poisoning that kind of runs its course in fluids and rest, but the bacterium doesn't usually damage the intestines severely. Some cases are relatively mild or even limited GI illnesses. However, these flu-like or stomach bug symptoms can be an early warning in some patients with the illness if it doesn't stop there. Thing is that when you get it as a GI symptom, so that vomiting, abdominal cramping, whatever, diarrhea, the thing is that you can leak that into your bloodstream. This is the second way that it can provoke a disease is septicemia, okay, or AKA a blood infection. Vibrio has a really, devious ability to get from the gut, okay? The gut can invade the bloodstream, especially in people with weakened immune systems or underlying conditions, okay? So this leads to sepsis, which is basically like full body bloodstream infection. So there's a whole entire definition for sepsis, but that is a very, very, very bad bloodstream infection that is now affecting all your organs. Patients deteriorate really quick with fever, chills, dangerously low blood pressures. That's called septic shock, okay? And then blistering skin lesions as the bacteria pretty much disseminates. The term invasive septicemia is used when the infection spreads internally. The alarming fact is that Vibrio is 80 times more likely to cause bloodstream invasion in people with compromised immunity, particularly those with chronic liver disease, compared to healthy individuals. That's a lot. 80 times more. Okay, so once it's in the blood, the mortality rate is frighteningly high. About 50% of these patients may die, even with treatment. That's how bad it is. If you're an immunocompromised individual, you're 80 times more likely to get this infection. And of those people that do get infected, 50% of these patients can actually die even with treatment. We're not even talking about like someone that just didn't get any help.
Exactly.
Okay?
Yeah.
The majority of fatal cases progress with lightning speed. Many victims actually succumb within 48 hours, 2 days.
Damn, that's fast.
Yes, 2 days. And this is with treatment.
Yeah.
And it's one of the deadliest foodborne infections known. The third way that you can get an infection or a disease from Vibrio is a necrotizing wound infection. The word necrotizing for us in medicine, when you hear necrotizing, you run.
Yeah.
You run. So this is the scenario behind the flesh-eating bacteria. That's like where it commonly gets its name from. It's this type of infection. If Vibrio enters through a cut or a wound, it can really cause a severe skin and soft tissue infection. So early signs include swelling, intense pain. We're talking about, for us, when they were teaching us about this kind of infection, it's out of proportion to what you're doing. So you just touch it and they're like wildly in pain. Also, you can have a hemorrhagic bulla. So basically a blood blister, like really bad blood blister, and large, just fluid-filled blisters too, okay? The infection can necrotize tissue, literally meaning that your tissue will die, like dead tissue. That's why it's called necrotizing. This bacteria can basically rapidly destroy the tissue. It can rapidly destroy the muscle and the subcutaneous fat. This condition is a form of necrotizing fasciitis. That's what it leads to, fasciitis, which can kind of feel it's an anaerobe. This kind of bacteria, when it gets deep into the tissues, it starts necrotizing. So it starts releasing like these gases. So when people feel the wounds, it actually like cracks under.
God. Oh my God.
You're just touching the wound and it's like cracking sound like Rice Krispies.
Oh, that sounds so bad. So bad.
It is really bad.
Oh.
And all
Have
of
you ever
that,
seen it?
huh?
Have you ever seen it?
I have not, no. I feel like when I was a medical student, I think we had, if I'm remembering correctly, I'm pretty sure we had a patient, but I didn't see him on his initial presentation.
Yeah.
I had already seen him when he was already in the hospital and he had necrotizing fasciitis, but it wasn't from Vibrio, it was from something else. But I saw like the consequences of a necrotizing fasciitis and it was awful. Like we're talking about multiple rounds of surgery and wound debridement, like all that. Patients often develop ulcers. This is like what I was seeing like as a medical student, like the consequences. I didn't see him when he initially had the infection. It was like the things after.
Right.
So ulcers, gangrene, all these like really, really, really bad wounds. Okay. And the infection can advance in a matter of hours. And that is something that's like very significant. If you have a patient with an open wound and it has progressed within hours, they're intense, like out of proportion pain, and you're feeling the wound and you hear cracking, you need to run. That is like a medical emergency. The infection can advance within hours. So without prompt treatment, it can spread into the bloodstream. And then that's when we complicate things into septicemia and basically like septic shock. You're going to die from an infection. Okay. So even with treatment, many require intensive care and emergency surgery. This is including aggressive debridement. Debridement means you're cleaning the wound, right? Aggressively, right?
Like
so you can do it in the patient, you can do it in the OR. So you're cutting away all that dead tissue, you're washing away all of that dead tissue. And sometimes it does require amputation so that it doesn't spread.
Keep spreading, yeah.
In healthy people, Vibrio infection via a wound or a food ingestion might stop at a more localized illness, which is still pretty bad. Yeah. So, the GI symptoms or like maybe wound abscess, which I still think is pretty bad. Many folks with normal immunity clear the infection before it ramps up, but doctors note that most healthy people who get infected with Vibrio or have a Vibrio exposure won't actually end up in the hospital because their immune system can actually fend it off before it gets out of hand. However, that's not everyone, right?
Yeah.
It's just most cases. It is important to emphasize that Vibrio, for all its horror movie reputations, does not cause a flesh-eating disease in everyone that has it, okay? However, if the conditions are just right, a high bacterial load and a deep wound, delayed treatment, or an at-risk person, Vibrio can really be severe. In these severe cases, outcomes are not that great, right? So overall, across all forms of infection, roughly 20 to 33% of Vibrio infections end in death, even with medical care. That's a lot. Yeah. And in the worst infections, death can come really fast. It's a really tiny bacteria, but it's very devastating. Okay, so why is this bug so virulent? Part of the reason it's because it has an arsenal of like toxins and aggressive growth. Vibrio has a very protective capsule to evade our immune system as well. Apart from that capsule, it pumps out like destructive enzymes. Even if your immune system is trying to battle it, it's like releasing things that are going to basically like fight it off.
Right.
And also because of all these like proteases and cytotoxins, which are all things that just like degrade protein and all these things, it's going to degrade through your tissue. It also thrives on iron. If it gets access to iron in the body, say like someone that has excess iron storage, it multiplies even faster. In fact, lab studies show that Vibrio can double in number about every 15 minutes when it has warmth and plenty of nutrients. The same setup it finds in human tissue. So that growth rate, even short treatment delay, can actually let the bacteria multiply and explode so that doctors jump in fast with heavy duty antibiotics. This is why aggressive treatment is actually really critical. Okay.
Oh, it's bad.
Yeah, it's terrible. And if you've seen, you can Google The wound infections from Vibrio, it's disgusting.
Warning, if you do
Yeah,
that.
yeah, yeah. That's what I'm saying. Like, you can Google it. We're not going to post anything up
No,
here,
no, no.
but you can Google it if you want, if you have the stomach for it.
Yeah. Oh my God. No, I'm not even gonna say it. Not even gonna say it. Anyway, so where and when does Vibrio strike? It's naturally found in coastal waters, as we've said, around the world, though. It's everywhere. But it prefers certain conditions. It thrives in warm temperatures. It's mostly abundant in the summer months. That means like May through October, at least here in the US. And that's when the seawater is at its warmest here. It also favors low to moderate salinity, so brackish water. So it's that mixture of that salt and fresh water, where rivers meet the ocean typically. Classic hangouts are the Gulf Coast bays and estuaries, but any warm coastal area can definitely harbor it. In the US, historically, the Gulf of Mexico states, so Florida, Texas, Louisiana, reported the most cases out of all the states, really. However, in recent decades, scientists have observed Vibrio expanding its range and popping up in places that it once considered too cold. Again, climate change is real.
Yeah.
Along the U.S. East Coast, infections increased eightfold from 1988 to 2018. And each year, the northern limit of cases has crept about 30 miles further up the coast on average. Warmer ocean temperatures are a major factor for this spread. Regions like the Chesapeake Bay and even the Northeast U.S. have started seeing occasional Vibrio infections during heat waves or unusually warm summers. In fact, in the summer of 2023, several cases as far north as Connecticut and New York reported severe and fatal cases of Vibrio for the first time, following a period of abnormally high coastal water temperatures. This prompted the CDC to issue a special health advisory in 2023, a warning that warming coastal waters are leading to more Vibrio infections in new areas. Beyond the US, a similar pattern is seen globally, and its Vibrio cousins are showing up in higher latitudes. For example, Northern Europe saw over 1,000 Vibrio cases in recent years, mostly during heat waves. The bacteria have caused illnesses around the Baltic Sea and as north of Scandinavia when summers are hot. That is crazy because I went to Scandinavia and that water was freaking cold. That water was so cold.
It's crazy how like just a little bit of change in temperature can really shift the ecosystem.
Yeah, climate change. It's real.
It's real.
Anyway, so one study estimated that worldwide the number of days per year with coastal conditions favorable to Vibrio growth has increased by 10%, by about 10% since 1980s due to ocean warming. In other words, climate change is giving this microbe more opportunities to flourish in places and times of year it previously wouldn't. Seasonally, the old saying was avoid raw oysters in months without an R, meaning skip them May through August. That's because summer is peak Vibrio season. Indeed, Vibrio concentrations in water are highest in the warm months, but that rule isn't foolproof. Up to 40% of cases actually occur in cooler months, September through April. So you're not completely off the hook in winter. Warmer regions like South Florida, or the Gulf may maintain Vibrio year-round, yay us. While late summer
the closest one was here in Broward County.
I know. It's really been all around the news, at least for us, for a good reason too. I think there was another one by like the middle of the state, but anyway.
Central Florida.
Yeah. So while late summer is prime time, caution is warranted anytime the water is warm enough. That's generally around 15 degrees Celsius or 59 degrees Fahrenheit. And that's a threshold for Vibrio.
I'll stick to the pool.
Yeah. Importantly, Vibrio is not only seen in all waters. It tends to cluster in certain coastal environments. It's rarely found in fresh water. It doesn't like fresh water, like alone. That's why it's got to be like that mixture of the salty,
because
brackish.
it's halophilic.
Exactly, because it needs that salt, right? But wait, because we're only talking about Vibrio, but that doesn't mean that, okay, let me just get into fresh water, because fresh water is a cesspool pool as well for other things.
Yeah.
So you're not being like, oh, well, then forget it. Let me go to the lake.
Yeah.
Hold.
Yeah, there's things.
That's a whole other episode that we're
Yeah.
not going to go into right now.
Yeah.
Anyway, also not common in open ocean or colder foreign currents and whatnot. The Pacific Northwest of the U.S., for example, Vibrio infections are very rare. Yeah, honestly, if you see Vibrio in like off the coast of Seattle, like the world is ending, I think,
Yeah.
at that point. Colder Pacific waters seem less hospitable, but on the Atlantic coast and the Gulf and parts of Asia, like Korea, Japan, Taiwan, Southeast Asia, and the Caribbean, this germ is a known hazard in the hotter months. As ocean climates change, surveillance is expanding. Health officials are now monitoring Vibrio in places like the UK and the US Northeast, where it used to be virtually unheard of. In summary, Vibrio strikes where the water is warm and brackish, so where there's that little bit of salinity in it, and when the temperatures are up, and those conditions are becoming more frequent in places.
All right, let's talk a little bit on who are the people that are most at risk, which we've kind of touched a little bit on. So anyone theoretically can get a Vibrio infection, but the severity of the illness is going to vary between individuals. So the scary, life-threatening cases tend to happen to people that are particularly have risk factors. High key risk groups are going to be people with chronic liver disease, like we had mentioned. This is the classic risk factor because patients with cirrhosis from hepatitis, alcoholism, or hemochromatosis. There's so many things that can cause cirrhosis, but these are the people that are extremely vulnerable. Their immune system in the liver are impaired and the iron levels are high, right? Vibrio absolutely thrives in high iron environment. In fact, heavy drinkers with liver cirrhosis who eat raw oysters form a disproportionately large fraction of fatal Vibrio cases. One study found such individuals are 80 times more likely to develop invasive bloodstream infections than healthy people. Tragically, some folks have learned that this is a hard way, as you'll see in the little story that we're going to say below. The other risk group is diabetics and people with weakened immune systems. This includes people that are on immunosuppressants, medications that are going to suppress your immune system, like rheumatoid arthritis, or people that maybe had an organ transplant, maybe those that are on chemotherapy, or those that have chronic kidney disease. All of these individuals are compromised. So a compromised immune system means that the body can't contain the infection. Diabetes, for example, not only impairs immunity, but can cause poor circulation. That's a really big thing in diabetics, making it really hard to fight a limb infection, especially when it is so progressive. These patients are at higher risk for the infection turning really severe. Now, other groups are older adults. Again, as you age, your immune system goes down. Vibrio can affect young, healthy people, but really, stats show middle-aged and older adults, especially men over 40, have more severe outcomes. Partly that's because they're more likely to have the above conditions. Years of heavy alcohol use, type 2 diabetes. This is where those numbers or where those statistics come from. There may also be some biological factors. For instance, some studies note that men suffer worse Vibrio infections than women. It's hypothesized that the estrogen in women might offer some protection, or that men more frequently engage in high-risk behaviors like consuming raw oysters with a beer on the side. A double whammy for someone that can become a potential Vibrio victim. Regardless, being male and over 50 with any health issue puts one at higher risk. Now, people with cuts or new tattoos, exposed wounds in warm water, warm seawater, brackish water, this is obviously, you're going to be an at-risk population. So this is more about the risk of infection occurring in the first place. It's not so much like you're infected and how your body responds to it. This is like if you literally just put yourself out there and you get the infection. If you swim in coastal waters while you have an open wound, recent surgical incisions, fresh tattoos, piercings, you're pretty much just asking for an infection, right? And that could be with Vibrio. Yeah. Even healthy individuals can get severe wound infections if a lot of bacteria enters a big wound. Activities like fishing, boating, or cleaning shellfish can cause small cuts that get exposed. A minor cut can serve as the entry point for Vibrio, and if conditions are right, high bacterial concentrations, delayed wound care, it can really escalate. The bottom line is that water and wounds do not mix. If you have a cut, it's wise to just stay out of the seawater or make sure it's just well protected. The other at-risk population are consumers of raw shellfish, especially high-risk individuals. So eating raw oysters or clams is a gamble if you're in the region where Vibrio is present. For most healthy people, the worst outcome might be a nasty bout of like diarrhea, but for high-risk people, like those with liver disease, the same oyster can deliver a lethal dose. Health agencies warn that anyone with the above medical condition should absolutely avoid raw seafood. It's just not worth even risking it, right? So even for healthy folks, understanding that raw shellfish carry natural bacterial risks, nothing is eliminated by some lemon juice, like what we were saying, alcohol, hot sauce, which is what I like douse mine in. All of that is really important to know. To illustrate the risk, one medical report noted that virtually all patients who developed Vibrio sepsis had an underlying condition. In one series, 96% had liver disease, alcoholism, and another immunocompromising condition. So that tells you that this infection preys on vulnerable populations, but it's not an absolute. There have been healthy people that have really bad luck and develop necrotizing fasciitis from Vibrio after seawater exposure. It's just much rarer than the usually associated and extremely heavy exposure. Again, unlike contagious diseases, you cannot catch Vibrio vulnificus from another person. You have to have that exposure. There's no person-to-person transmission reported. You have to have that environmental exposure, so water or food, to get it. While it's a terrifying infection, it's not an infection in the conventional sense. Oh, you have an infection, you're gonna give it to me. It's like, I can't give you
not
any
contagious
infection.
like that.
Okay. It won't spread through community by contact. So each case is essentially a separate case on its own.
Alrighty. So treatment and prevention, right? Because this sounds just awful. Treating Vibrio infections is a race against time. Okay, given how fast the bacteria can multiply and cause damage, doctors emphasize early and aggressive treatment. Truly, every hour counts. If a clinician even suspects a serious Vibrio infection, for example, a patient with a wound exposure to seawater showing signs of the infection, they will immediately start antibiotic therapy. Do not wait for lab confirmation at this point. It's like, don't stop for go.
Yeah.
If a clinician, this is one of those treat first, ask questions later scenarios, because delay just could be deadly.
Yeah, that's why it's like they drill into us the symptoms. So crazy pain, crackling wound.
Every time you say crackling wound,
it's literally what it is. It's terrible. It's just like, go straight to antibiotics and consult surgery. Like,
Oh my God. The recommended antibiotic regimen for severe Vibrio infections is usually a combination of 2 powerful antibiotics, typically a 3rd generation cephalosporin.
Cephalosporin, yeah.
Plus,
You said it right.
plus doxycycline. That one I knew. This combo has shown synergy against the bacteria. Alternatively,
Fluoroquinolones.
yeah, antibiotics can be used as well. These are given intravenously in high doses. Supportive care in the ICU, IV fluids, medications to support blood pressure if in shock, ventilators if needed, is often required for septic patients when they get to that level, unfortunately. For wound infection, surgical intervention is as crucial as antibiotics. Surgeons will open and debride, like we said, cut away all that necrotized tissue aggressively. If the infection has spread through a limb, fasciotomy, so cutting along the fascia, so around that area of the skin to relieve pressure and remove infection. This is as bad as you can imagine. How bad you're imagining and how it sounds, it's that bad.
And also, guys, like when you do a fasciotomy and you're cutting the fascia to relieve that pressure, patients stay with that wound open. So it's not like they open it and then they close it in surgery and, you know, they send you to your room. No, you're in your room with open surgery.
Oh, God. Just so bad.
They cover it and, you know, they put a lot of things to help the wound healing, but they actually have to wait a couple days and then take you back to the OR to finish it off.
All right, so in many cases, an amputation of an infected limb is sadly the only way to prevent the infection from continuing to spread and remove all the toxin-producing tissue and bacteria that's in there. It's a drastic measure, but it can be life-saving. A phrase that's often quoted in the medical circles, time is tissue, meaning the longer you wait, the more tissue is lost. So rapid surgical consultation is needed. Often multiple surgeries, like she just said, are done repeatedly to just wash out that wound. If the infection is caught very early, so say like when you have a stomach, GI issues, GI symptoms, gastroenteritis, but no sign of sepsis, sometimes supportive care and antibiotics just might be enough. But given the stakes, doctors usually err on the side of hospitalization and IV treatment for any suspected Vibrio infection beyond just like a trivial run-of-the-mill skin wound. Yeah. There's no vaccine or magic antitoxin for Vibrio. It's all about antimicrobial therapy, supportive care, and unfortunately surgery when needed. So does treatment work? It can. Patients who get prompt, so like we keep saying, time with this infection. Appropriate antibiotics have a much better chance of survival. So if treatment is started early in the course, before full-blown sepsis or extensive necrosis, many patients can actually pull through. In less severe cases, recovery can be complete with no long-term issues. However, sometimes in cases that are just really advanced, even the best efforts sometimes fail. As noted, mortality in septic cases is around 50% despite treatment. The key is prevention. Not getting infected in the first place is obviously ideal. So if you see like a warm, brackish situation, don't go in there.
You don't need to go in there.
You don't need to go in there. Go into the open ocean.
Yeah.
Go to a pool.
Yeah.
I don't know. Go to the actual ocean.
So many bodies of water.
Yeah. Don't go. And then plus there's sharks in brackish water. You don't want to be in there.
Oh, hell no.
You don't want to be in there where the estuaries are. That's shark breeding area. You don't want to be in there.
No.
Okay. Anyway, so here, this is coming from Floridians. Okay, we know what we're saying. So this is the Australia of the U.S. Here are some prevention tips for, to stay safe of Vibrio, especially if you live or visit the coastal areas. Avoid raw or undercooked shellfish, especially oysters, if you are in high-risk group, especially then. Health authorities flat out advise that people with liver disease, diabetes, or weakened immunity should not eat oysters, period. Okay, so it's not even because of Vibrio, it's because of so many reasons.
Yep.
If you're healthy, recognize the risk. Raw shellfish carry pathogens. To be safe, cook shellfish thoroughly. Boil, steam oysters until shells open. Then continue cooking for a couple of more minutes. Now, this is not a cooking episode, so I'm not going to continue on that. But the point is, cook it. Proper cooking kills the bacteria. That's the best thing I could tell you.
Yeah. And also, just like piggybacking off of that, don't just think that if you put like hot sauce and lemon, that it's going to kill the bacteria.
No, it's an old wives' tale, though,
that is
unfortunately.
Dumb. That is dumb.
Like, don't do it.
Yeah. Obviously, again, other things is like avoid exposing open wounds. Don't go into that water if you have a cut, scrape, or you just had a recent surgery. It's like, I get it. You wanna go have fun at the beach, but no. Okay. Not the time. Not the time. Water and wounds do not mix, as the Florida Health Department bluntly puts it. If you cannot avoid the contact, use waterproof bandages, and even then, okay, I don't recommend it. I actually, if someone tells me they're going on a beach vacation and I had a case where the little girl got a dog bite and she was going to Puerto Rico and she was so excited to go to the beach. I'm like, I'm really sorry, but she cannot go in the water. Period. Yeah. Okay. And but what if we use the bandages? I actually suggest they use the bandages because even when I tell you not to get it wet, it's still somehow, for some reason, going to get wet.
Yeah. Mostly could.
Mostly it could. Exactly. Again, if you're in the restaurant business or something like that and you are opening up oysters or prepping them, always wear gloves when you're handling raw fish, especially if you have any cuts on your hands, which is probably something very common for people that maybe work in the kitchens. Yep. Always wear protective gear when necessary. Fishermen, oyster harvesters, or anyone handling sharp shells should be wearing gloves. This not only prevents the injury, but also reduces the infection risk. Just be extra cautious around storms and floods. Heavy rains, hurricanes, storm surges can also wash Vibrio into water like inland. So if you're cleaning up after a flood, protect your skin. Unfortunately, post-hurricane floodwaters have caused spikes in Vibrio wound infections. That is something that you can see. Okay?
Yeah, seen it post-hurricanes.
Yeah, especially going into the new hurricane season.
Yep.
So refrigerate seafood, avoid cross-contamination. If you buy shellfish, keep it cold and cook it promptly. Don't let raw seafood juices just drip on other foods and surfaces because they can live in those drippings. Yummy. Yeah, know the signs of infections. Obviously, if you develop severe pain, swelling, blistering on a wound after you've gone to the beach, or if you have symptoms of fever, chills, vomiting, diarrhea after eating some seafood that you didn't cook, just go to the doctor.
Yeah.
And honestly, sometimes I think it's doctors just knowing this history will actually put you on prophylactic antibiotics.
Yeah.
Early antibiotics can save your life. Don't just, say, whatever, I'm going to wait for it to improve. Following these precautions dramatically lowers your chances of a nightmare situation. Now, just driving home the whole entire Vibrio vibe, let's look at real life cases where people have gotten these infections.
Yeah. So I'm going to go ahead and talk about like a good case study that would work as like an example of how this happened. In June 2017, a 31-year-old man from Texas made headlines after a seemingly harmless choice turned deadly. This gentleman had just gotten a new tattoo on his calf. Just 5 days after getting this tattoo made, he decided to go for a swim in the Gulf of Mexico. That warm water, Texas coastal water, was exactly the kind of environment where Vibrio just thrives. Okay, so unknown to him, bacteria likely entered through the fresh tattoo wound on his leg. Within a couple of days, he fell violently ill. He developed severe pain in his legs, fever, chills, and the tattoo site became red and horrifyingly blistered with fluid-filled, like blisters, pretty much. By the time that he reached the hospital, he was in septic shock. Vibrio was identified from his blood and wound cultures. It turns out that this man had some major risk factors that made this infection especially severe. He had a history of alcohol abuse and chronic liver disease, cirrhosis.
Yeah, so he had like two things going on. You were at risk because you had a medical history that would put you at risk, and then you also put yourself at risk by going into these brackish waters with a new tattoo.
Yep, exactly. In fact, he was drinking about 6 beers a day and had alcohol-related liver damage. This is essentially the perfect storm we discussed. Vibrio exposure, plus an open wound, plus underlying liver cirrhosis. His body's immune system couldn't contain the infection. Doctors immediately started aggressive treatment, IV antibiotics, supportive care in the ICU, pressors for his low blood pressure, mechanical ventilation, the works. They noted how quickly the infection in his leg was progressing, literally turning tissue necrotic within the first 24 hours. Despite initial stabilization and the best care, his condition remained extremely fragile. He developed multi-organ failure, his kidneys and other organs were failing due to septic shock, and surgeons had to manage the limb infection to try to stop the necrosis. Tragically, after about 2 months in the hospital with ongoing complications, the man died from the infection and its complications. The case was written up in the BMJ Case Reports Journal to educate others. Then the lesson was clear. Do not expose fresh tattoos to marine water, and patients with chronic liver disease must avoid such risks at all costs. As one of his doctors put it, for folks with liver conditions or immune compromisation, however you would term it, avoid raw oyster ingestion and avoid swimming in seawater with open wounds. Those are high-risk activities.
I think it's just super interesting, apart from learning about the bacteria and the disease and the symptoms and how to treat it and how fast we need to act.
Just really fast.
It's super fast. And I think what's very interesting is how a role of climate change can affect medicine and what we see.
Yeah.
As climate change worsens, right? We're going to have warmer waters, more hurricanes.
Yep.
More hurricanes means bringing in those microbes into the inland, right? So more into like the waters inland, more exposures. So it's just a little glimpse on how climate change can really affect medicine.
Yep.
Again, this is when you go to a doctor and you tell them this, it's not like the first thing that you think of is like Vibrio,
Of
right?
course.
However, obviously, if you're having those obvious symptoms, you will. But it's interesting to consider how the effects of the climate, if like climate change, can really lead to more numbers, basically, like just increasing the risk of you. Can you imagine, like every single summer now we have to worry about Vibrio?
Well, it's been almost like every,
right?
almost every summer was something like this. But people don't. I don't think it's
Don't link that together.
Yeah, they don't link the climate change actually affecting us to a medical sense, to our health.
Exactly, to our health, yeah.
They say, oh yeah, it's only getting hotter, this and that. Well, that causes a lot. Other than like, obviously like heat stroke and dehydration and all those things.
All the other summer funds.
All those things. That's adding to this. Like there's people seeing it now in...
Oh, heat stroke is another one that we can talk about.
Yeah. People seeing it now in the Northeast.
Yeah.
And stuff like that. Places that they hadn't seen anything like this before. So it's just, it's an obvious sign,
Yeah.
but
Anyways, that was Vibrio.
Yeah.
Vulnificus.
yeah. So
Flesh-eating bacteria that everyone's talking about.
yeah. And just because you think that you don't have an underlying disease or anything like that, so you're gonna be fine if you go into
Yeah. Don't wait it out. Just go get checked out.
because you don't know either. You don't know if you have something underlying. Unfortunately, these days you could. Just I'm sure that guy didn't like the case study that I talked about. He probably didn't know he had freaking liver cirrhosis.
Yep.
And he just found out then, unfortunately, and then he passed. So you don't know, and that's why if you don't know, it's better off don't test your luck. You know? But anyway, thanks for tuning in. Let us know what are your thoughts and all that. Any cases or not cases, but any topics that you guys would want us to touch upon in the future, anything like that. We always put those first.
Yeah.
So let us know either here in the comment section of wherever it is that you're listening or watching this. Subscribe for us on YouTube, and we're available on all streaming platforms as well. We're also in all forms of social media pretty much. And if you're not into any of those things, our email is funnymedicine305@gmail.com. And thanks for tuning in, and we'll see you on the next one.
Bye.